We're Sentia Health. We are in the business of streamlining and automating processes, and we have even automated the production of new software. Usually, we talk about the state of healthcare and health insurance in the United States, but today is a little different. Today, we are going to discuss the 4 perspectives on healthcare and healthcare finance: the patient, the practitioner, the hospital or practice, and finally, the legacy insurance company. I'll be back after the presentation to discuss our conclusions and what this all means to you.
Normally, we talk about healthcare and healthcare finance, and today is not really different. However, we are going to talk about what the big players think about the current system, what they think the problems are, and how Sentia can help make the whole thing better. Let's dig in. First and foremost among the concerned parties is the patient, the one who receives the benefits of the system and pays for the entire thing to spin. But what do patients want? Patients want to be left alone. I think that says it all. Patients, people, just want to not be bothered and be left to live their lives the way they best see fit. Patients want to be healthy, completely at odds with the first thing that patients want, to be left alone, is to be healthy. Of course, nobody is born with the knowledge of how to take care of themselves. Long term, most of us use a combination of make it up as you go along and what your friends and relatives say you should be doing. Patients want inexpensive health care. Nobody wants to pay extra for anything. I believe that we as a population think we are getting fleeced by the big insurance companies and probably the hospitals too, with lots of expensive tests and upcoding. Upcoding is the process of switching out one procedure code that the practitioner picks for another, that the insurance company will pay more for. This is one of the things that the Epic billing system is famous for, and it drives up costs for everyone. Patients want to mostly be left alone. They want to be healthy, and they are mostly willing to do what it takes. But they need access to information and advice to do what is necessary to get there. What we need then, in the words of Dr. Christopher Vezzi, is an easy button. A single place where the patient can go to view his or her medical records, insurance information, patient education, and of course, contact their practitioner. Second only to the needs of the patient are the needs of the practitioners. Practitioners want to be left alone. Medical professionals want to be left alone to practice and not be annoyed with dealing with insurance companies, regulators, and hospital administration. Practitioners want easy, accurate documentation. Practitioners hate EMRs. Practitioners hate EMRs because there aren't really any EMRs, there are billing systems. Billing systems aren't granular enough and simply do not have the language necessary to document a patient encounter. Practitioners want to be left alone to practice. They need a one-stop shopping solution for everything they do, including the medical record, the insurance information, telemedicine, secure email to answer and ask questions without being too invasive, and generally just practice medicine without the business of running the practice. They need to be able to see what is covered and for how much, to avoid excessive cost and maybe avoid doing things that aren't covered, or figure out a better way to do what needs to be done without harming the patient financially. Isn't that part of the Hippocratic Oath too? It should be. We don't really think about the needs of the hospital or practice, but they are crucial in this process. Everything has to have a place to happen. Hospitals and practices want to be profitable. Profit, or in the case of a non-profit, not losing money, is the name of the game. Most of these entities are businesses, and as such, they only exist to make money. Hospitals and practices want to automate manual processes. Let's face it, work sucks. If we are sweeping floors, digging ditches, or running a hospital, we all wish there was a machine that could make the work effortless and easy, so we can focus on actually improving the way things are done. Imagine having a ditch witch or a Roomba that would run your practice for you. Hospitals and practices want to know where the money goes. This is actually a little different than being profitable, but those things are related. Making more money is exactly the same as spending less money. And if you can find the cash leaks, you don't have to charge your patient more to keep your enterprise running. Hospitals and practices want to be left alone to make people better. Sure, some of them are for profit, and that is fine, even necessary. But they don't really want to have to maximize billing to an old, wasteful legacy insurance company. And they don't want to have armies of accountants, billers, and coders to do it. They want the same easy button that practitioners and patients want. Nobody cares what the big insurance companies want. Everyone that doesn't work for or depend on them for income just wants them to go away. We don't really need a summary here. The insurance company should assess your risk, charge you a fee to manage the data, and be done with it. Everything they do that isn't assess risk and pay for your healthcare is costly, wasted effort that you get charged for. We have a list in the conclusions of the wasteful things your legacy insurance company does that don't need to be done, but the big lesson here is that these big, greedy banks need to go away. Let's take a look at how we can address the points about what everyone wants. If we distill down what everyone, except the insurers, they seem to be the problem, wants, we find that everyone wants the same things. Healthcare to be as inexpensive as possible, as easy as possible with automated processes, to not have policy dictated and work assigned to them by people that don't help patients. Expense and complication are the biggest problem in healthcare today, and not only in the US. At Sentia, this is our main reason for being. We have a three-pronged approach to control costs. Every medical conference there has ever been has a breakout session on figuring out where the money is going. Usually, the conclusion of these breakout sessions is put an accountant in a room with a spreadsheet until he or she figures it out. This is the wrong solution. We are working on a practice management system that documents and tracks every penny that comes into and goes out of the practice or hospital. It includes these modules: accounting, asset management, purchasing and acquisition, human resources, inventory, project management, customer relationship management, CRM, reporting. Together with reporting, these things control every penny the enterprise earns and spends. This means that we can generate a full, detailed profit and loss, P&L, on demand and/or for a project or set of projects, like a surgery or a department, that will immediately find your cash leak. For publicly traded facilities, that means that you can no longer hide the money. It will become painfully apparent where the money goes when the shareholders or board of directors asks for a P&L in real time. The OECD average mortality for behavior-based, avoidable chronic disease is 225 deaths per 100,000 in population. In the US, it is 336, about a third higher. If we account for the fact that this behavior-based, avoidable chronic disease consumes about 84% of all healthcare spending in the US, and we spent $4.9 trillion in 2024, then we can say we spent over $4 trillion on just avoidable, behavior-based disease. If we can use the health and wellness module discussed above to just get us down to the OECD average, we could save $1.34 trillion as a population. This won't be immediate, but will happen over time. To encourage people to read and comply with our patient education, we will offer a small discount for simply reading it. If they comply with it, as evidenced by better, or at least not worse, clinical measurements and lab results, then we can offer a double-digit discount on health insurance. This gives the teachable a big discount for saving us all money, and the risk is shifted to the people who are costing us money by making them pay more. I mean, not giving them the discount. We stated above that we are working on the ERP-style PM system. We have a solution in place, built and deployed, that automates the entire health insurance system. To accomplish this task, we provide the electronic medical record system, EMR, to the hospital or practice. As the practitioner documents the patient encounter, we detect procedures performed and pay for them in real time. This eliminates medical coding, pre-authorization, insurance networks, adjudication, delays, denials, rate negotiation, sales brokers' agents, the cost of a third-party EMR, skyscrapers in every major city in the U.S., and the hundreds of thousands of employees that work at the insurance company that you, as the insured, pay for. For the privilege of managing your data, we charge $10 per month. Of course, you have to pay for the risk incurred, but you are already doing that. For a detailed discussion of risk, what it is, and how it is calculated, visit our Substack site. There is a link in the pinned comment. The $10 per month replaces the list above with automation. We do it all and save you about half, which is what your legacy insurance company simply wastes or steals. That bears repeating. We will save you about half. If we transfer all hospital savings to doctors, either as cash payments or less work, that is, time off to avoid burnout, and the health and wellness process is successful, and we save 50% by automating health insurance, we are looking at a 75% savings, 50% immediately from automating of health insurance, and another 25% over time as the incentives kick in. The least expensive country in terms of per capita expenditures on healthcare is South Korea. The insurance automation alone should put us on an even footing with them. Cutting out another 25% of the whole or 50% of the remainder makes healthcare in the U.S. about half the cost of the cheapest in the OECD, while not affecting how medicine is practiced, nor reducing care and decreasing doctor burnout. This is also the only plan that actually works and doesn't cost twice as much as everyone else. In fact, half of the cheapest over time. We have the health and wellness and the EMR built and deployed for use right now. The ERP-style PM system has been designed and is in the process of development. Contact us here or on our site, and we will be happy to provide a demonstration of the fully functional prototype. If you liked what you read, please like and subscribe. Click on the notification icon, subscribe to our newsletter, and follow us on all our social media and blog sites.
We have shown a way to make patients healthier by educating them on the consequences of their behavior, and a way to capitalize on that to the sum of $1.34 trillion, or about 25%. If we add that to the process automation savings of our solution, we are in the ballpark of more than 75% savings in total. We already have the best doctors and the best equipment. We just need to implement the above detailed framework to give them all the tools necessary for success. We have this system in prototype now, fully functioning. Contact us here or on our site, and we will be happy to provide a demonstration of the fully functional prototype. If you liked what you heard, please like and subscribe, click on the notification icon, subscribe to our newsletter, and follow us on all our social media and blog sites. You can read the text version of this presentation at sentiahealth.substack.com or sentiahealth.com. We have built a comprehensive health information system to keep the patient healthy and on the right track with the ability to incentivize healthy living. Implementing this system should be fairly simple and will completely revolutionize the way healthcare is performed and paid for, saving countless lives. We have shown a way to use this system to make the best healthcare system in the world, also the most efficacious and the most affordable.